Welcome to Public Health on Call, a podcast from the Johns Hopkins Bloomberg School of Public Health, where we bring evidence, experience, and perspective to make sense of today's leading health challenges. If you have questions or ideas for us, please send an email to publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu for future podcast episodes.
This is Lindsay Smith-Rogers. Colorectal cancers are on the rise among people under age 50. Today, epidemiologist Dr. Otis Brawley talks to Stephanie Desmond about some of the reasons behind the surge and what can be done to reverse the trend. He also explains why any approved type of screening, not just colonoscopies, can save lives. Let's listen. Otis Brawley, thanks so much for joining me.
Thanks for having me.
It's nice to have you back, and I wanted to talk today about colon and rectal cancers. They are on the rise, especially with those under the age of 50, and they're even declining over the age of 65. So paint us a picture. What's going on here?
Yeah, colorectal cancer is a fascinating disease. If you look at the entire population in the United States, about 150,000 people get diagnosed with colorectal cancer every year. It's about 52 to 53,000 who die every year. Now, if we look at the epidemiology, look at the numbers in the population, since 1980, the risk of dying from colorectal cancer for all Americans has halved. This is a real success in both good screening and good treatment, that the average American's risk of dying from colorectal cancer in 2024 is half what it was in 1980. Now, I told you about all Americans. Unfortunately, the risk of people under the age of 55 has actually gone up, and it's gone up more recently. Let's give actual numbers. In the 1990s, every year, about 10,000 of the 150,000 or so who were diagnosed with colorectal cancer were under the age of 50. 10,000. Now it's 20,000. It's doubled. And it's doubled in about 20 to 25 years. We don't know why. We have some suspicions. One of them is, colorectal cancer, as you would expect, is very intimately entwined with diet. Our diet in the United States is changing dramatically. We're eating a lot more cheese, a lot less milk. When we look at dairy, it's changed dramatically. We're eating a lot more processed and ultra-processed foods. The other thing that has changed a great deal is this generation of people who are now in their 40s. They've gotten a lot more antibiotics than almost any generation in the past. We've talked about how we're overusing antibiotics. We're giving people antibiotics for viral illnesses when they really don't need them. What that does is it changes the bacterial flora of the gut. They're good bacteria in our colon, and we're killing them off by overuse of antibiotics. The other thing that's happened dramatically is we have an obesity epidemic in the United States. In the United States in 1970, 15% of Americans were obese. Today, it's well over 40%. In certain communities, in the Black female community, it's over 60% are now obese. And obesity does drive colorectal cancer as well. So all of these things are coming together and may very well create the perfect storm, that we have more younger people getting colorectal cancer. And again, when I say younger people, it's primarily people age 45 to 55, but we also see a slight rise among people age 40 to 45. And then we do see a small increase among people even in their late 30s.
So what can we do? So I know that recently the cancer screening age was lowered, the recommended cancer screening age. Talk to me about that.
Yeah, and one very effective thing in colorectal cancer, especially among people age 50 to 75, is we have a number of studies. This is unlike breast and prostate cancer, where there is some debate about the efficacy of screening. But in colorectal cancer, we have a number of studies that consistently tell us that screening people age 50 to 75 saves lives, prevents deaths. Screening can be colonoscopy, it can be stool blood testing every year, it can be stool DNA testing every 3 years. All three tests, by the way, are equal. And some people think colonoscopy is supreme. That's not true. The best test is the test that's available to you. And I say that because there are some people who need to drive 3 hours in order to get a colonoscopy, but stool blood and colonoscopy can cost $3,000. Stool blood testing costs $30 a year. Now, if you do have a positive stool blood test or stool DNA test, you then need to get that colonoscopy. Now, I was actually the chief medical officer of the American Cancer Society, and I was on the committee that suggested that rather than start screening at age 50, we should start screening people at age 45. Now, we took a little bit of a jump there. We don't have studies to show that screening people age 45 to 49 saves lives. We have a lot of studies to show that saving people age 50 and above. And what the committee said is, what's the difference between age 50 and age 48? We decided to stop at 45 because that's where the majority of the problem is. It's in people age 45 to 55 right now. But people who are under the age of 45 who have bowel symptoms ought to go see a doctor and talk about possibly getting one of these tests. We feel that everyone age 45 and above to get regular, routine, high quality colorectal cancer screening. But people who are under the age of 45 need to be aware of colorectal cancer symptoms. And if they have what might be colorectal cancer symptoms, number one, they need to realize it probably is not colorectal cancer, but it is worth having a conversation with a doctor and possibly getting one of those tests.
I wanted to go back to colonoscopy because it is talked about as this gold standard of screening tests. It's the virtues of it. You can go in and you can remove precancerous polyps if they're seen. There's a lot of hype about the colonoscopy. I'm surprised to hear you say that the other tests are just as good. Can you tell me more?
Yeah. Well, colonoscopy, it's fiber optics, it's high science, so it must be better. The truth of the matter is the studies that told, and I'm a man of science, I like to look at clinical trials. The study that told us that colonoscopy saves lives was a study of almost 200,000 people that started in the 1970s at the University of Minnesota, and it randomized people to stool blood testing every year or every 2 years or no stool blood testing at all. It was a third getting each. And if one had a positive stool blood test, they won a colonoscopy. Now, the study has reported in the New England Journal almost every 5 years since about 1990, 95 or so. And the data, the most recent data shows that among people who got stool blood testing every year, there was a 33% reduction in risk of colorectal cancer death and a 20% reduction in actually getting colorectal cancer. Now, how does that happen? Well, people who had stool blood testing every year, who had a positive stool blood test, got a colonoscopy, and it either found an early cancer, which was treated, or it found a polyp, which was on its way to becoming cancer, and that polyp was removed, so we prevented the person from having cancer. So this study showed us that stool blood testing every year is associated with reducing the risk of getting colorectal cancer through finding these polyps that are really precancers and having them removed through colonoscopy. Now, when you look at that University of Minnesota study, 44% of people getting stool blood testing every year got a colonoscopy in a 10-year period of time. Our advice to get colonoscopy is simply based on the fact that 44% is close to 50%. And if half of people getting stool blood testing, or essentially half of people getting stool blood testing every 10 years are going to get a colonoscopy, it's not much of a far step to just say, why don't we just give colonoscopy to all of them? Now, there's a lot of people who think that colonoscopy is the gold standard, but the truth of the matter is we have no data to show that colonoscopy every 10 years is better than stool blood testing every year. Now we have the stool DNA testing that's also done, and that's every 3 years. And if you're a public health guy like me, you're actually grateful that the data and the evidence has lined up the way it has. Because if I recommend a colonoscopy every 10 years for everybody in the United States, and then I look at the GI doctor distribution in the United States, I don't have enough GI docs who can do a colonoscopy so that everybody in about 15 states in the United States can get a colonoscopy every 10 years, starting at the age of 50. Now I'm moving the recommendation to 45. And so I'm really in a problem that I don't have enough GI docs to do all the screening that would be necessary if we only use colonoscopy. So again, I am so grateful that my data shows that we have other tests beyond colonoscopy screening that are just as effective.
I wish we had talked last year before I got my colonoscopy. It was fairly miserable. Anyway, so what can we do? I mean, we have an obesity problem and we have a diet problem. We have an antibiotic problem. So what can we do?
Yeah, by the way, I mentioned obesity in adults, but it was 5% of kids who were obese in 1970, and it's 20% today. And so this obesity issue starts in childhood. And we frequently say cancer prevention, cancer risk reduction is a pediatric problem. We need to worry about this in our kids who are 5, 6, and 7 years old. We all need to, and I am the first who needs to do this. We need to try to eat 5 to 9 servings of fruits and vegetables every day. We need to try to get 30 minutes of exercise every 4 times a week. Some people say every other day, but 30 minutes of good exercise. Walking around the block is good exercise 4 times a week. And we need to try to maintain an ideal body weight. We need to try to avoid processed and ultra-processed foods. When I talk about eating good foods, we need to try to limit red meat consumption to no more than 3 times a week. All of these things over a period of 20, 30, 40 years will lower one's risk of colorectal cancer. Now, I should also point out there's a small number of people who are in families that are at high risk for colorectal cancer. If your family has cousins, sisters, brothers, aunts, uncles, even parents who have had colorectal cancer in their 20s and 30s, then you need to go talk to a doctor about that, because screening and surveillance for you may very well be different from what the recommendation is for the general population.
And it can't solely be obviously genetics, because genetics don't evolve that quickly.
The genetic issue with colorectal cancer is a small one in terms of overall. But, people tend to look at folks that they see in the media, for example, and his family's been open and honest about this. Chadwick Boseman, the actor, he had colorectal cancer in his late 30s. Well, he has siblings who have colorectal cancer in their late 30s as well. They have a family predisposition to colorectal cancer. And if I were giving advice to a family with a history like that, my recommendations would be very different from colonoscopy, stool blood testing, or stool DNA starting at age 45.
Is there one overall message you want people to come away with?
There is one message that I want people to come away with, and that is if we can eat 5 to 9 servings of fruits and vegetables, maintain an ideal body weight, and then do 30 minutes of exercise 4 times a week, we reduce our risk of colorectal cancer, we reduce our risk of a number of cancers, and we reduce our risk of cardiovascular disease and diabetes. And of course, no one should be smoking. That's the one message. But the one thing we haven't talked about yet is 40% of Americans over the age of 50 have either never gotten screened for colorectal cancer or are not up to date for screening for colorectal cancer. That's a colonoscopy every 10 years, stool blood testing every year, or stool DNA testing every 3 years. The number of lives that could be saved if we went from 60% of people over the age of 50 being up to date on screening to just 70% being up to date on screening is significant. We're talking about colorectal cancer screening among people under the age of 55. Let's remember the majority of people who get colorectal cancer are over the age of 55. And so I want to promote awareness of this disease amongst younger people. I also want to promote awareness of this disease and awareness of screening amongst people over the age of 55 as well.
Otis Brawley, I could talk to you about this all day. Thanks so much for joining me.
Thank you. It was a pleasure talking to you.
Public Health on Call is a podcast from the Johns Hopkins Bloomberg School of Public Health, produced by Joshua Sharfstein, Lindsay Smith-Rogers, Stephanie Desmond, and Grace Fernandez-Ciceri. Audio production by J.B. Arbogast, Holly Cardinale, Spencer Greer, Matthew Martin, and Philip Porter, with support from Chip Hickey. Distribution by Nick Moran. Production management by Catherine Ricardo. Social media run by Grace Fernandez-Ciceri. Analytics by Eliza Rosen. If you have questions or ideas for us, please send us an email to publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu for future podcast episodes. Thank you for listening.